going over this one of the favorite question of the examiner. This was not discussed in the last session of your management of NF2 and all those things. This asks us identify the device. SRS is recommended as what size of tumor and what is pseudo progression. Okay, so we all can see that this device is cyber knife. Okay, so don't go after this another thing. This image is given in your Scott down. So be familiar with this image. This has more chances of being asked. Okay, and what is the size for which SRS is recommended? Can somebody help me out with this thing?
3 mm, sir.
3
mm.
Yes. And apart from that, देखिए, that's why that is the point to make a mistake over here, so that we don't make a mistake at the main thing. Okay, so SRS is generally recommended for tumors less than 3 centimeters. Okay, and we are more likely to make this mistake when that timer is on in front of us. Okay, so that's why this is a very good thing that we should keep on revising again and again. Okay, so let's go back again to the questions what they are asking. SRS is recommended, that we know. And what is pseudo progression? So this pseudo progression is also given over here. I have just taken it from today's session, are mostly from Scott Brown and Lalwani. Okay, so this what is pseudo progression? We have read about it that following this treatment there is a transient enlargement of the tumor. Okay, and followed by that it may become stable or vigorous. So this is called a pseudo progression. Okay, and they might even ask you what is the percentage of vestibular schwannoma for pseudo progression. So please remember 23%. 23%. Another question which can be asked from this session is what is the difference between SRS and SRT? So we all know that in SRS the treatment is given in a single sitting, and in SRT multiple sittings can be given. Okay, so this thing is there. Apart from that, one more question can be asked from this place is what are the differences between cyber knife and gamma knife? So we have studied it last time, so not making you bored again with this thing. And over here, this question we have discussed. And third question which can be asked is, what is the dosage which is given? Okay, currently most centers give about 12 to 13 grays. Initially it was 16 gray. In last session, we discussed something about RION, that is radiation-induced optic neuropathy. Okay, so this is how we should continue revising it. Coming to one of the old time favorites, what is the principle of PET scan? Name 2 radio tracers. So one radio tracer we all remember that we keep on commonly using it, that is your FDG. Uske alawa we have to remember at least 1 or preferably 2. And what is functional MRI? Expand, hold. So let's come to the principle of PET scan. Okay, so what is basically this PET scan thing? So what happens is that the radio tracer which we use, that is basically it gets accumulated. So that radio tracer that gets accumulated into the cells. Okay, and then it starts decaying. And we all know that it accumulates more in the malignant cells as compared to the normal cell. And how it decays? How does it decay? It decays by emitting a positron. अभी क्या होगा? जो positron होगा, it will start moving from its axis, and what happens? It goes ahead, and in the road it meets a electron, and it goes and has an accident with this electron. So this positron, it collides with the electron, and collision से क्या पैदा होता है? Gamma rays. What do we have? This gamma particles. It comes out. Now, this is basically this gamma is basically detected by the tracers which are placed. Okay, and apart from that, next question which can come is what is SUV? So we all know what is SUV. And second thing is they can even ask you what is the formula to calculate SUV. Just remember this thing. They have this tendency of asking one odd formula every year. Last session they had asked how to calculate the cochlear duct length. Okay, so this can be one of the ad-hoc questions. So SUV is calculated by tracer uptake divided by administered activity, patient weight into 1000. Okay. And so over here, what is functional MRI? So we all know what is functional MRI. Basically, it's a type of dynamic MRI, seeing the exact what all things are happening physiologically in the real time in the brain. Okay. What is the full form of BOLD? Can somebody from the new session unmute and answer it? What is BOLD?
Blood oxygen level dependent.
Blood oxygen level. Great. तो ये अपने को हो गया. Apart from that, what else we have? This is what all radio tracers are there. We know details about FDG. FDG का full form याद रखेंगे तो बेहतर है. Apart from that, we will have a shorter one is thymidine. This you can remember. 11C choline can be remembered. And there is something called this FED-NIM. There is a difficult name, long thing associated with it. If you want to remember, you can go for it. Otherwise, ये ऊपर के तीन you should remember. Okay. Now, one more thing I wanted to just discuss with you guys. See, these are the images. Okay. So we all will be easily able to identify what is PET scan. Okay. That is also something like a bright light which shines. This is how I remembered in a layman's term that how to identify a PET scan. This is again, both the images are from Scott Brown. Now coming ahead, these two are separate images. Okay? These images are of your functional MRI. So one thing, there was a confusion which one of the candidates had asked that how to differentiate between how to differentiate between PET and this functional MRI. तो ये कैसे differentiate करना है कि PET scan is generally of whole body. They will be giving you a wider section with a history of some malignancy, something like that. Okay, so in the PET scan, basically there will be a history of malignancy, and they will be giving you the picture of that whole body kind of thing, from where you could see that there is more uptake of certain thing. Whereas in the functional MRI, generally they will give you the picture concerned only with your brain / intracranial activity. Somewhere it can be this yellowish fire kind of thing. Somewhere it will show you this reddish kind of thing, depending upon the various sequences which are involved. Okay, so you shouldn't make a mistake identifying it wrong, because identification of a thing is carrying 1 mark. So don't make it wrong. They can even give you these kind of images and identify what kind of investigation is taking place. Then they might ask you what is functional MRI, what is the principle behind functional MRI, what is BOLD, what is SPECT. All those things can be attached to this kind of question. Okay. So coming to this previously asked question, we have discussed it around 2-3 times. Again repeating it because it's an important topic. Okay, I'll again enumerate these topics before starting with this question. In otology, the first topic which you should start is your squamous. When you get bored of squamous, come on these topics. First is your superior semicircular canal dehiscence or the third window syndrome. Second will be otosclerosis. Otosclerosis, its surgery, it's again very important. All the instruments of Stapes surgery are very important. 1, 2. Number 3 will be your Meniere's disease. Fourth will be your sudden sensory neural hearing loss. These 4 topics you should revise it in a single stretch whenever you are revising, and implants उसके बाद में आएंगे. ठीक है, whenever you are revising implants, definitely one question is generally from your implant, whether from cochlear, ABI, Baha, something like that. You should revise it. But otology जब भी पढ़ रहे हैं, तो these 4-5 topics you should definitely revise it. So let's see this question. A 45-year-old male presented to the OPD with the complaints of impaired hearing in the right ear, listening to his own footfall. ठीक है, listening, see, footfall and transient vertigo, disbalance while walking. His HRCT temporal bone images are shown over here. So we all know what is the diagnosis of this patient. The diagnosis of this patient is superior semicircular canal dehiscence. Okay. Coming to the first question. What is the gold standard investigation for identification of this case? Can somebody unmute and try to answer?
Then HRCT and VMP.
अगर गोल्ड स्टैंडर्ड बोल रहे हैं ना, तो स्कॉट ब्राउन सेज HRCT is gold standard. ठीक है. VAMP is used for investigation of this particular disease, but when it comes to gold standard, please answer HRCT. source Scott Brown 8th edition. अभी इससे latest nothing has come yet. Okay. So for exam purpose, we should know this. This is HRCT. I'll share the screenshot of Scott also after this class. What is the type of hearing loss that is seen in above patient? There is no fun in telling. The answer is CHL, conductive hearing loss. Now when it comes to vestibular function test, then you can answer your VAMP. Now coming to VAMP, both of this, that is OVAMP. Okay. Coming to OVAMP, OVAMP for Scott Brown says that sensitivity is around 90%. OVAMP के लिए 90% है, and for CVAMP, just to make our life more harder, they are saying that specificity and sensitivity both is 80 to 100%, and now they leave it to the discretion of resident that you can write whatever you want, and then the examiner can have our happiness. Okay. So you can answer anything, but one thing that you should see when the percentage of CVAMP is more, if you have to answer only one thing, you should answer CVAMP. Otherwise, you can answer completely VAMP only. Okay. What is the full form of Fiesta MRI? Can somebody again help me out with this answer? What is Fiesta? Try it out.
Fast imaging implies steady state acquisition.
Steady state acquisition. Definitely, Dr. Rathi. That's a great answer. Please, I will again like to lay emphasis on this fact. These small acronyms, they carry 1 marks, and every year they are asking 1 to 2 acronyms. So 2 number आपके यहाँ से बन जाते हैं. Standard 2 numbers you can get from these things. Okay, and these are such things that we commonly use in our daily setup. So if you just make a list of around say I think 20-25 से ऊपर नहीं होंगे, so I will make a cumulative list, short form करके I'll accumulate everything and send it to you on the group slowly. Keep on adding to it. You can edit the question, edit them, and again post in the group so that you can revise it from that one single PDF only. I'll do the initial wala push. I will do it, whatever we have shared, and you can edit and add whatever you know extra apart from that, and the full forms which you know. Okay. So this we will do it. I'm having this Saturday and Sunday off this weekend, so I will do this task for both the June and the August group. Okay. So far Fiesta का आपने ये देख लिया. That's good. And coming to the 2 surgical approaches. So surgical approach में Scott Brown mentions 2 names. One name is Lone-Parne occlusion of the round window. And second thing which you can answer is the name which they say is plugging, /capping, /resurfacing. Anything you can answer. Apart from that, multiple other approaches are given. You can answer any 2. So coming to this is the graph. Cervical VAMP which is given. Coming to this, you can again see this thing. CT image of your superior semicircular canal dehiscence syndrome. So they can ask you also that what view do you see? So 2 जगह दिया हुआ है, partial view दिया हुआ है, transverse view भी दिया हुआ है, but it's better you should answer partial view over here. Okay. So remember the CT scans, important sections you should remember. And let's go ahead. We will revise CVAMP and OVAMP in a nutshell. Please remember the location of electrodes. Some people have joined us new, so for them one small piece of advice will be, don't go too much into the details of these investigations. Like there will be some questions, there might be some questions giving you the graph of ENOG, giving you some investigation, fancy investigation, and 4 questions will be there. One question will be identify what is this thing, second will be some theory, and third will be what is the interpretation of this year. So if you have read it entirely 3 years, you have been following it, you are you'll be more than happy to answer it. But just for that 1 marks, don't entirely dive into it कि नहीं अब तो मैं एकदम ENOG, VLG और ये सब कुछ कैसे interpret करेंगे, I will read everything. No, you definitely leave it and move ahead to the next question if you have not read it till now. Got my point? Okay. So in CVAMP, how do you identify? There are 3 places we should place the electrodes. So this is the important thing, that this main electrode is placed on your sternocleidomastoid, whereas इसका जो contemporary है उसमें the electrode is placed where? Over here. So that is the main difference, which is over here it is placed. Second thing, you should go once with the graph what the recording it's showing. not very important for you guys. Just remember it. Image you should know. The pathway is mentioned over here. That pathway you should know too, and what is the utility of these things. Where else we can employ these things, that you should know. Okay. So moving ahead. So please identify what flap it is. This is from
Jugulo-palatopharyngoplasty.
This is jugulo-palatopharyngoplasty. Okay, you are mentioning the surgery. Okay, the question is little bit different. That why मैंने इसको black करके रखा हुआ है कि what is the flap over here. So let us delete it. The answer is post jugulopalatal flap. ठीक है, images from your Lalbani I have taken it. Surgery's name you have answered accurately, Dr. Irfan. So yeah, just have a look how this will look alike. Okay. So now we will discuss 3-4 things about your this surgery. ठीक है. तो जैसा आपने बोला, this is jugulo-palatopharyngoplasty, also called as UP3 procedure. So it is one of the very commonly used surgical technique for your OSA. Okay, so you should know this thing. Let us see. This is the essentials of UP3 that you should know. Not keeping aside the theory and all the ratafai wala things hatate hue, main points you should remember. Coming to a questionable approach. What is Fairbanks technique? 1, and elaborate smile. So can somebody again unmute from the new session of August wale people? Unmute and please let us answer what is Fairbanks technique. Yeah, what is the surgery known as? पुराने वाले में से कोई आंसर करो.
UP3.
UP3, ठीक है. So this is your standard UP3. Whenever you are reading about the OSA surgeries, UP3 should be your first thing. What we do is we start from all the everything, malam patti और पलाना टिकाना सब कुछ शुरू करेंगे. UP3 तक जाते जाते we sleep off. Okay. So my idea is we should start from the most important things first and then go down. Okay, so read about UP3. It's also known as Fairbanks technique. So it can be given to you as an image-based question, like जैसे यहाँ पे दिया हुआ है. ठीक है, both the images can be given, and they can ask you what surgery is being performed. 1, what is the other name of procedure which is being performed. Okay, so coming to this elaboration of smile. So let me answer this thing. I have this answer written with me. The answer is submucosal, minimally invasive. Lingual excision. Okay, there is one more short form which can come from this place, that is CAPSO. CAPSO. CAPSO का full form होता है cautery assisted palatal stiffness operation. अच्छा, one more thing over here. Let me add a page over here. For a patient of OSA, what blood investigation will you advise? Like deviating from the OSCE topic, just a small viva thing. Try karo.
blood gas, sir.
EBG can be tried, yes, but commonly OPD में आप उनको क्या blood test बोलेंगे? That is your
Thyroid, sir.
thyroid, ठीक है? T3, T4, TSH should be the one of the most which you should advise to your patients. EBG तो बहुत बाद में आ गया, ठीक है? तो एक आपने थायराइड का सीरम थायराइड हार्मोन लिख लिया. Now second question which can come from over here is what is the name of sleep scale that we associate with OSA?
Epworth sleepiness.
Epworth sleepiness.
ठीक है? Epworth sleepiness scale is associated though. Number third question can come is that is your PSG. ठीक है? PSG का एक बार फोटो और ग्राफ देख लेना. For all these things, ना see whatever you see ना, it's not necessary that the same image might be repeated. The only thing that you can do is very easy is when you use your Google next time. So just put that keyword images and top 3-4 images देख के you just feed it into your brain. Okay? So आएगा उसी से आएगा. If they will not repeat the image, कुछ और image copy करेंगे, है ना? That's all we all do. अच्छा, one more question which can come over here is that is DISE. ठीक है? Full form of DISE is drug induced sleep endoscopy. In this 2-3 things that you should know is one is the parameters that we are seeing. 1, Second, what classification is used for dice?
Vote.
New people. अरे vote. बहुत बढ़िया. And third thing is they can even ask you what drugs you are using it. ठीक है, तो this we had discussed in our previous session. So कुछ भी 2-3 drugs को याद रखना है and keep revising it. Okay, so vote is important. ठीक है, vote classification is important and just go through it. Okay, coming ahead with one of the very popular question. A 10-year-old girl came with complaints of hoarseness of voice and chronic cough since so and so. Given is the endoscopic picture for you. What is the diagnosis? What is the staging? Diagnosis batao, staging batao, management options that we have, and the vaccine. So answer goes as ठीक है, juvenile onset recurrent respiratory papillomatosis. Okay, guys, three things. फिर से repeat कर रहा हूँ exam तक. I will keep on repeating multiple times. First is never use short forms till you pass your exam. Second thing is whenever any image comes in front of you, please check अगर वो drug है कि उसकी date of expiry तो cross नहीं हो गया है. It has happened in past that date of expiry has been repeated, like given to you, and you have been asked that how will you give this drug. So अगर expiry लिखा है उसमें, please check it and answer it that this drug is out of the expiry, cannot be given to the patient. 2. Number 3, whenever you are examining the patient, please remember 5 points. Whether examiner is seeing you, whether he is not seeing you, make it evident that you wish the patient. 1, you introduce yourself to the patient. 2, number 3 is explain it what you are going to do. 4th, take consent. Show him what you are going to do, and after your procedure goes completed, say thank you to the patient until you pass your exam. उसके बाद it's all up to you how you keep up these things. But for DNB, please remember it. Okay. So diagnosis हमने JO RRP कर लिया. What is the staging protocol for this thing? Can somebody help me? डर के. ठीक है. So जैसे हम लोग DNB से डर के रहते हैं, sorry for the talks. Just try to remember it. ऐसे ही जिनको जॉर्प हो जाता है वो लोग डर के रहते हैं. बस just remember it somehow. ठीक है, and if this question comes in the exam, so it will be good for everybody of us. Okay, ये हो गया. What are management options that we have? There are multiple management options that we have for JORRP. Let's start with these things. I'll just enumerate them. We all know that this is microdebrider, there is cold steel, there is laser. Adjuvant में क्या क्या use करते हैं? Now I will need your help. I have not read this JORP from
overuse. Idofovir is there. And bevacizumab.
Interferon alpha.
And recently now photodynamic therapy is also given.
Interferon alpha, photodynamic therapy. ठीक है, 1, 2, 3, 4. Anything else? I'm also not remembering it. मुझे adjuvant याद था अपने exam time में जब रट्टा मारा था. ठीक है, nothing apart from that. Okay, so just read it once. In case कुछ होगा तो we'll share it again. Laser जब भी पढ़ोगे, laser के साथ साथ you should remember the image of laser. 1, symbol of laser जो है. 2, laser जिसने invent किया था कुमार एंड पटेल, Indian scientist. Remember his image. 2, number 3, laser का wavelength याद रखना है 10,600 nanometer. 3, 4, laser safety protocols. ये साथ ही साथ दिमाग में चलना चाहिए. It shouldn't happen that you will revise this and you are reading laser again. ना, जब भी लेजर आएगा these 4 things should come into your mind. चलो, ये हो गया. Vaccines we did. हाँ, बोलो.
I'm saying that in post of celecoxibs are also given to these.
Yeah, coxibs are also there. And I'm just forgetting one thing. There is one more thing which is applied to the base so that recurrence is less. I'm sorry, I'm not able to remember it. There was one girl of I think 7-8 years old who was operated 7 times. मतलब horrific to just to listen only. तो उसके लिए we had decided that अगर इस बार उसके माइक्रोडेब्राइडर के बाद अगेन रिपीट होता है तो we will apply that thing. I'll share it. I'll just again Scott पे दिया हुआ है and I'll share it with you guys. Okay, so moving ahead, 2 vaccines we have. First vaccine is your Cervarix, ठीक है, 16-18, and second is बड़ा वाला GARD, Gardasil, ठीक है. Gardasil में you will have 6, 11, then 16 and 18. What schedule that we have is it's given 0 to 6 month. ठीक है, here is a confusion alert. This has been answered multiple times as 0, 1 and 6, है ना? So I've checked it from Scott. 0 to 6 है. Go with this thing. Okay. Okay. Let's move ahead. So coming to one of the favorite question back again, what is field cancerization? New people, August session. Can somebody give it a try? Who gave it? One. Second is what is field cancerization? एक नंबर का क्वेश्चन है.
Slaughter.
Slaughter at all. Thank you, doctor. Yeah, बिल्कुल. First answer is correct.
Deletion.
Okay.
The mucosa of upper air digestive tract is exposed to carcinogen at the same time. So they are a different degree of differentiation.
Great. है ना? So Dr. Saab has answered it correctly. Please remember it. This is a potential question that can be asked. That what is field cancerization? Okay. So I'll mention all the details in a PDF, but whatever you answered is absolutely correct. Okay. So coming to again one of the previously asked questions, I have included it for the new guys. 6-year-old child presenting with midline cystic swelling as shown in the figure moves with deglutition. Surgical specimen is so and so. Image is from Scott Brown. Diagnose the clinical condition. So answer is thyroglossus. So I hope I am correct. Okay. So second is what is the pathophysiology? So we can write it like from where it starts. Incomplete descent की वजह से in the midline this can happen. So what is the treatment of choice? Now again I'll need your help.
Fist trunk operation.
Fist trunk procedure. So they will ask you what is fist trunk procedure and what is the surgical steps that you will take to prevent its recurrence. So exactly in Scott Brown where they mention this fist trunk, वहाँ पे 2 line लिखा हुआ है उन्होंने that you have to remove a piece of hyoid bone, asparagus, keep some part of base of tongue, a cuff of the muscles all around the tract rather than just keeping out the whole जो fist आप निकाल रहे हैं. सर्जिकल स्टेप हो गया. What this is called as modified fist trunk को नाम से कुछ लोग कर रहे हैं. What is the most common malignancy which can occur in this lesion and mention its incidence? August वाले people.
Thyroid carcinoma.
Dr. Priyanka आपको पता है. I remember it. ठीक है. The answer is papillary carcinoma of thyroid. अब इसका percentage भी बताओ.
Then 1%.
1%. ठीक है. Answer goes OS within 1%. Okay. Second thing over here, one more question which can come is there's something called a Schelling procedure. Schelling procedure was the old surgery which used to take place for this thing. This is basically simple excision, only excision of your cyst or tract, whatever has been formed. So अभी basically it is discontinued. अच्छा, one thing for you to do today, Scott Brown खोलना है, papillary carcinoma वाला जो chapter है वो निकालना है. इसका plain HPE जो image है, please go through it. One, second, जैसे ये खत्म होता है, again उसका अगले में दिया हुआ है मेडुलरी कार्सिनोमा. इसका इमेज देखना है, एचपी इमेज देखना है. वन, व्हाट म्यूटेशन गोस टू एंड उसके अलावा इसका ट्रीटमेंट क्या है. ठीक है. So you don't read too much. If you will read too much in a single sitting, likelihood chances is that you will not do anything. है ना? So just specify only 2 things. I will only read about papillary carcinoma thyroid, not much, only HPE image. HP में सारा आएगा. इसका HP आएगा, Samoma bodies will be coming, coffee inclusions, वो owl eye, वो orphan ani eye, वो सब कुछ एक साथ करना है. All the HP images. One, I'll share it entirely, the entire PDF अपने session में, but ये पहले से करके रखना because medullary carcinoma of thyroid was asked in the last session. So there is a possibility कि अगर medullary नहीं पूछेंगे तो papillary पूछेंगे. So you should be ready with this thing. Okay, coming ahead. So again a simple go. This patient, and image I copied from Google. Which sign is being elicited? How do you elicit that sign? What is Ebola parotid? So first answer I request from you guys. Which sign is this?
Crosser sign.
That is, we all are on the same page that this is Shostak sign. ठीक है. अभी I have included in the PDF कि Shostak कैसे करते हैं. One. Second thing is Trozius sign भी अपने को पता होना चाहिए. What is the Trozius sign? Number 2, what is Ebola parotid? I'll have just mentioned it. What is Ebola parotid is basically a artificial parathormone. Okay, Ebola parotid is your artificial parathormone. I will write it. Just remember the name. Okay, so over here these both are mentioned. Okay, so how do you go for Shostak sign? Basically, you have to tap at this thing anterior to your ear, and grades के बारे में भी दिया हुआ है. Nobody will ask you with so and so many details. This is from one handbook of head and neck oncology. Okay, So this is your soft हो गया, this is your trousseaux हो गया. Remember these values they might ask you कि sphygmomanometer को कितनी देर के लिए रखना है. All those things can come. So remember these two images. Okay, this can be a potential question. Coming over here, Dr. Rohini, आपने पूछा था इसके for regarding this question. So this is point wise that you can go with this RAI therapy, and every institution per se has a different protocol while initiating this therapy for the patients. So if your institution is like opting for certain other points, that also may be included. This is the standards generally like which you can answer. Basically the introduction, what are the advantages, disadvantages, what are the indications for RAI, and what do you will do before RAI, how will you counsel the patients, and what are the factors affecting its treatment. Okay, so coming ahead, this question is for the FAT exam. Two people of among all these two groups will be appearing for FAT exam. अभी कुछ दिन बाद होने वाला है. This is a very important thing for you. One triangle can definitely be asked. Second, whenever you will be discussing thyroidectomy, तुरंत वो क्वेश्चन पूछते हैं कि how will you identify RLN, how will you identify SLN. So you should be ready with that answer. सारे तो याद करने की जरूरत नहीं रहती है, बट जो मेन अपने को रहता है जॉल्स ट्रायंगल, दैट यू शुड रिमेंबर, एंड बियर्स ट्रायंगल, दो हम लोग को रहना चाहिए कि SLN के लिए है ना RLN के लिए. अपार्ट फ्रॉम दैट, टू थिंग्स अगेन रिवाइज सर्निया क्लासिफिकेशन, and this is basically your that distance, what is the distance of nerve that is from the pole of thyroid, but you should go ahead. Again, this question is being repeated. What is Wagner's and Grossman theory? That has been asked once in your FAT exam. Likelihood are there कि this can be repeated again. अच्छा guys, आप सबने जब आप जो भी अपना FAT exam दिया था, please revise those questions again. Okay? So there is a possibility that these questions get incorporated in your main exam. In case अगर आपके FAT में like properly अगर exam में questions आए थे तो. One distant cousin of Wagner's and Grossman theory is the Simon's law. Over here, just go through it. Okay, coming to one more very favorite question of the examiner. This question can be given to you in a GIF based format. This can be given as a small 15-20 second video. I'll share it on for a YouTube link for this thing. Again, I'm sharing an image. Now, guess what surgery is being performed?
Thyroplasty, sir.
Kashima.
कशिमा के अलावा एक और क्या नई चीज आई मुझे बताओ.
तो कॉर्डेक्टमी.
भाई कॉर्डेक्टमी तो है, ठीक है, कॉर्डेक्टमी है. दिस इज एब्सोल्युटली राइट. दिस इज योर पोस्टीरियर कॉर्डेक्टमी, आल्सो नोन एज काशिमास प्रोसीजर. बट एक टाइप 2 थायरोप्लास्टी कहां से आया था? ठीक है, सी द थिंग इज कि वी शुड रिमेंबर कि व्हाट काइंड ऑफ मिस्टेक कैन हैपन विद अस. It's not about only one person. We all don't know each other. Okay, so this is the thing कि अगर हम इसको वीडियो देखेंगे ना, please everybody, I'll request कि इसका सब लोग वीडियो देखिएगा एक बार. Okay, so this thing anybody can write. Okay, so the exact answer which you should answer for this thing is your देखो यहाँ पे this red point is being दिख रहा है ना, this red point सब लोग देख रहे हैं ना, everybody is able to visualize this thing. So this is basically probably they are using a laser for this surgery. Okay. So thyroplasty में तो generally we don't use these things, ना? So that's why we should pick up the points for answering this thing. Okay. Okay. So this is basically your posterior cordectomy, like commonly called as Kashima's procedure, and this is basically your interim measure for your bilateral abductor palsy. Okay. Coming over here, there are certain signs which have been asked. So I would like to just take these things over the next few minutes. Okay, so this sign is basically your national sign for your National Program for Prevention and Control of Deafness, NPPCD. लिखा हुआ है NPPCD. ठीक है, so please remember this sign. Okay, coming to this question again, revision for the previous older session. मैं नया वाला सब revise करना है. When is the World Hearing Day celebrated? What was the theme of this year? Can somebody try it out? अभी पुराने वालों का रिवीजन है, बताओ.
Third one is
Theme was testing for small children.
Sorry, I didn't get it. Dr. Akash, क्या बोल रहे?
don't remember exactly, but it was for
3rd March is the
preventing
ठीक है ना? तो
preventing deafness in small children.
Yeah. So the answer is changing mindsets. ठीक है? What you're answering is correct, but the exact keyword what WHO has basically propagated that we should exactly write it. उसके बाद नीचे whatever you want to explain, you can explain it, है ना? So from today till the date of our practical, we should not forget 3rd March is our World Hearing Day. Okay, so let's move ahead. 1, 2, 3 again. HLAA. Why I have included these 3 images, you will come to know in the next slide. So what's the full form of HLAA? This is Hearing Loss Association of America, HLAA. Okay, over here only I would like to again go for 3 more short forms which can be asked. One is we all keep on saying कि हमने OCNA पढ़ा है. OCNA stands for, right?
Otolaryngology Clinics of North America.
Northern America, ठीक है. Second is your ASHA. This ASHA is not the PSM ASHA, तो वो वाला ASHA नहीं आंसर करने का है, ठीक है. तो ENT ASHA में क्या आंसर होगा?
American Speech and Hearing Association.
American Speech Language and Hearing Association. Okay, that is also correct. And third is again थोड़ा सा deviate कर रहा हूँ. AJCC आपको we all remember. AJCC पता है. One. Second question which can come from AJCC is what are the changes done in 8th edition? ठीक है, तो I'll share with you the PDF of AJCC 8th edition and specifically the changes. 2-3 changes हैं that we should remember. CA carcinoma में, I'm sorry, I'm deviating from the topic. Base of terms में आपका DOI include किया हुआ है. One question and second change they have done is in the malignancy of thyroid. उसमें they have had subtle changes. Anaplasty को थोड़ा सा change किया है, age for thyroid में change किया हुआ है. 2-3 changes हैं. So we will share with this thing. Okay, so ये तीनों हमने short form यहाँ पे देख लिया. Okay, so why had I included this thing? Just see this question. This has been asked previously. Identify the logo for program of deafness in India and what is the full form of official program. So अब बताओ इसका आंसर क्या होगा? A, B, C, D? C. Okay. So are you all with me? Na? We are all on the same page. The answer is C. And now what is the full form of this thing? We saw it. That full form is National Program for Prevention and Control of Deafness. Okay, तो एक नंबर हमारा आ गया यहाँ पे. Okay, now coming to second thing, when was the program started? See, they will out of 4 marks, one question will be there, which will be like problem वाला चीज करेगा. So this was started in 2007. 2007. What are the components of this program? This component of this program are again PSM. PSM stands for जो इसका full form है Preventive and Social Medicine, and what everybody else in the medical college calls is पेलो सोचो मत, just don't think, keep on writing whatever you want. This is your PSM thing है ना. Capacity building, manpower training and development, service provision, awareness, IEC. जहाँ पे कुछ समझ में नहीं आएगा PSM में IEC लिख देने का है, Information, Education and Counseling. Okay, so here you get 2 marks. See, PSM के लिए 2 नंबर दिया इन्होंने. So remember this thing, है ना? Don't. But the problem is कि we are out of writing all these theoretical answers for a long time now, है ना? So revise it, learn it. This is only one thing जहाँ पे theoretical answers आएंगे. Go ahead with this. Last question is again difficult part, which will be difficult for an ENT person to answer. That is, which government agency is responsible for providing hearing aid and cochlear implant under the program? The answer goes as Ministry of Social Justice and Empowerment. Okay, तो यहाँ पे आपको 2 चीजें याद रखनी है. 2007, ठीक है, and 2007 के अलावा this is the ministry which is responsible for this thing. Okay, this thing they have asked once. There is a possibility कि इसको पूछ सकते हैं, इसको पूछ सकते हैं. ये वाला I was not able to find out this logo. I tried it out again, but मिला नहीं मेरे को. तो अगर किसी को मिलता है तो please post it on the group. Okay, so coming ahead, repeated question twice, thrice it has been repeated by DNB, and 3-4 times I have also repeated it. We all know that this is your OAE which is being carried out. Second thing, again no need to answer कहाँ से auto acoustic emissions आता है, we all know it. The test can be answered as pass or refer. 2. Third thing is what is 1, 3 and 6 rule. Just please go through it. That this is basically your by the age of 1 month hearing screening should be done. 3 में आपका hearing evaluation should be done, and by 6 early intervention can be done. Okay, so over here 2-3 things for you people which I wanted to just put over here. यहाँ पे एक question will be there. Please read about Soham. One. Soham is again initiative launched by our Prime Minister. Basically, again for hearing screening. It's a similar kind of machine, somewhat similar to autocaustic emission. Just read it once. I'll share the PDF again of Soham. Okay. One is this. Second, this is something called as Nikshay. Nikshay is not really very important to us as our ENT perspective because, Nikshay is a program kind of thing which is associated with TB, tuberculosis. That in order to improve the nutrition in the TB patient, government is providing them pocket money of 500 rupees per month. Okay, so because TB can be asked in any format, TB in ENT is an important topic. So in that this thing can be studied, TB in ENT. One. Second is HIV in ENT. Okay, so in the next session I'll be including all the images related to these both things. TB in ENT and HIV in ENT, and one more thing I'll request you guys to start reading something on implant. We'll be having a small discussion on implants also, that what is the exact OSCE based question that can be asked for the implants, both for CI, ABI as well as your BAHA and its associates. And second thing will be its headquarters. ठीक है, इनका headquarters कहाँ पर है. Okay, 1, 2, 3. Okay, so for next class, the questions on biostats, they will be discussed. I'm sorry, I was supposed to discuss it today itself, but somehow it was going ahead and just shifting your gears from these questions to the boring questions of biostats of just very boring kind of thing. So I shifted it to the next session. We'll start with biostats. The questions which will be there is जो आपको पढ़ना है. One is your DOI. Second is Vancouver style में how to write it. How to write your publication in this style. Read these two things. And third thing that you should read is RCT. तीन studies आपको important याद रखनी है. What is cohort? What is your RCT? And apart from that, a triangle of levels of evidence. इसके अलावा around 10 questions more are there from biostats that we will discuss individually. One. Second will be osteology. I'm just enumerating the outline that will go. इसमें mandible revise करेंगे, maxilla revise करेंगे, and skull base again we'll touch upon it. Since we have discussed skull base पिछली बार में पढ़ा हुआ था, तो we'll just touch upon the important points. What will be in the mandible? One will be the mandibular defect. Two, classifications of mandibular defect. Three, reconstruction of mandible. Maxilla, one, classification of maxillary defect. 1, 2 is your maxillectomy का PDF we'll discuss. And third will be your incisions over the maxilla that we all have already studied, Weber Ferguson, all its 3 extensions. And इसके अलावा आपका हो गया maxillectomy ये, और what are the recon materials which are available for your osteology. तो number 3 will be your HPE. HPE में आपका क्या कहते हैं, will share the entire PDF एक बार फिर से. By the time we'll be reading about the important OSCE based HPE individually also, and the entire HPE which will contain around 20 to 25 images in a single PDF, which you would have stored it in your soft copy, that we'll discuss. 3, and coming to the instruments. These 4 things we'll try to cover it. It should be a long class of around 1 hour plus. So we'll start in time so that we could finish in time. Apart from that, these things, 2 sessions will be remaining. One will be the discussion of Siemens commerce, and one will be your thyroid discussion. This will again include the OSCEs of otology, KF discussion on Siemens commerce. This should be an important one and good for you for revision. We'll discuss it in some sort of different way, just breaking the monotony. We'll discuss what are the questions that are asked in Viva and how you should answer them. So that is a bit important. Okay, so apart from this, if you want anything else, still DNB is giving us time. I don't know it's good or bad. Okay, so we will keep on revising, we'll keep on studying. I was just wondering that we started the initial one in the June. Okay, so it's almost 3 months as we have been associated. It was really wonderful. And still DNB is giving us more time. And for the people we started up in August, we will be here for another this month till the exam dates are announced, and we'll push you till the exam. And then we'll finally again meet the day your exam results are declared. Okay, so the main idea is to keep yourself engaged, keep yourself motivated. Don't let that thing, because the main idea is that your theory exams concluded somewhere in May, है ना? तो वहाँ से it's almost 3.5-4 months have passed away. So your everything which you have read for theory will vanish. Everything will vanish. One. Number two, people who were not able to clear the last time, unko actually the gap has been very big. So the main motivation should be to study daily. Okay, because at a certain point of time our brain gives away. It says कि अभी हो गया, बस we have read it multiple amount of time. अभी देखा जाएगा, fail हो जाएंगे तो क्या ही होगा? No. Don't let these negative thoughts come into your mind. Study daily 10 to 15 minutes whenever you get bored up. Okay, open your questions. And second thing, for the August session, new guys, two things I have been keeping on repeating. Please make a PDF soft copy or something like that जहाँ पे आप लोग difficult topics keep on writing. मतलब there are certain important topics which you know that I forget them and I want to revise them at the end. Please make a list. Like for me, it was thyroplasty. For me, it was hypopharyngeal carcinoma, something like that. Because आखिरी के 48 hours will be very difficult. You will be traveling to a new place, to a new institution, and that will actually adrenaline rush होगा. There will be no studies which you can do. So it will come in handy for revision. That is very important for you. One. Second thing is, that is again a humble request. Syndromes. That is, there are around 10 to 15 syndromes. Please revise it slowly on a daily basis, and you should make a small PDF if you are revising it on a soft copy. Otherwise, एक stick-on note बनाना है and write out main important points how you will remember the syndrome. And paste it wherever you are studying, and जब आप exam के लिए जाएंगे निकाल करके take it alongside with your notes whatever you are carrying. We will discuss, we will share whatever you need to carry on your exams, all those things. So आपको ये सब करने की जरूरत नहीं है. The day your center comes, the first thing you should do is get your tickets done. One. Number two, take a hotel which is nearest to your center. I again repeated, अगर वो 1000-2000 महंगा भी होता है, take it whatever is nearest. उसमें make my trip पे वो डालना है कि this is my center. I want it nearest 1 kilometer, 500 meters, because you don't know. I'll tell you what happened with me. My center was in Mumbai, Nanavati Hospital, Nanavati Max Hospital in Juhu. And I was like stupid enough to take my room in Kolaba. I had one of my friends staying in the South Bombay. वहाँ पे I had taken the room. I thought I'll party a day before and अगले दिन exam दूंगा जा करके. And I was surprised that it was 1 hour. It took us in the morning to reach from my Kolaba destination to this Nanavati hospital. And there was smart people over there जिन्होंने नानावती के पास में they booked some room 500 meters, 700 meters, which took around 5 minutes, 7 minutes of walking for them. So this will come in handy. Please remember, take a room which is nearest to your location. One. And book your tickets the day your center comes, because don't keep on delaying. Flights rate will increase, and try to reach 24 hours before your exam. It shouldn't happen that कल आपका एग्जाम है मॉर्निंग में एंड आप लास्ट फ्लाइट पकड़ के जा रहे हो. प्लीज टेक सम टाइम. यू डोंट नो व्हाट इज केप्ट इन द फ्यूचर. फ्लाइट डिले होता है, कैंसिल होता है, तो यू शुड हैव सम टाइम फॉर रिएक्शन. Okay, chalo, we'll discuss these non-ENT things also in between. We'll see you on Friday. Tomorrow, like daily 10 to 15 important questions we'll keep on sending again and again. It's a humble request for the August session. Try answering the things. If you'll not answer, it's very easy for me to send the PDF. I have already saved all these things. I have please don't feel bad about it. I have these questions saved with me, and I have to just select and send it to the August people. तो अगर आपका आंसर नहीं आएगा तो I'll just send the answers again. It will be good if you interact. ये आंसर है, क्या हो सकता है, क्या नहीं हो सकता है. So the timings remain generally the same. I'll start sending 9 o'clock plus minus 5-10 minutes, because the day the class is there, I'm pretty sure कि 9 बजे I'm also here, you people are also here. जिस दिन क्लास नहीं होती तो 5-10 मिनट तो चलता है. तो please keep your mobile along with you, and whatever questions are question mark वाला है, try answering it out. Why you are taking a bet कि नहीं मैं तो final practical में ही answer करूँगा, है ना? So let's keep on motivating each other. Please study and clear this exam in single go, not another attempt. Okay, chalo, all the best. Have your dinner. Good night. Stay safe. We'll meet on Friday. Bye.
Thank you, sir.
Thank you. Thank you, sir.